Hello, and welcome to Health and Fitness Redefined. I'm your host, Anthony Amen. Join me today as we take a dive into the world of health and fitness, where we learn how to overcome adversity, depict back first fiction, and see health and fitness in a whole new light. Guys, I'm sure you listen to this and you're like, there's this guy named Anthony. He's this podcast host of Health and Fitness Redefined, and he talks about pain a lot. And we had a lot of people talking about how they overcame pain through different techniques, like myself. And I'm excited to have this guest on because he's basically premiering this whole new medical concept he has on pain and how to take care of it and how to make you feel better. But I really don't want to spoil it. So without further ado, let me welcome to the show, Dr. Richard. Welcome to the show.
Thanks for having me.
It's an absolute pleasure, man. I'm excited to talk about this new theory you have on what you call, I'm going to leave it blank and let you fill it in later. Haha, teaser. But so before we talk about that, though, and how you got into helping people deal with chronic pain, take us back. Why did you decide to become a doctor? And then on top of that, what made you transition from basic medical practice to discovering something groundbreaking?
Well, thank you. As I said, it's a pleasure to be here, and this is one of my favorite subjects. So I look forward to sharing what I can. And that is part of the reason that I became a doctor in the first place. I don't know where it says this, but doctor includes teacher, and helping people learn how to take care of themselves and helping people understand what's wrong with them, and actually helping to solve a problem that can affect any of us because we all have a body. It's something that was appealing to me as a kid, just wanting to help and wanting to be useful, and finding this body of ours to be an amazing thing. And so many mysteries of life that are still unanswered. They're tied into, how we get sick and how we heal, and what is this life force that's underneath all of this. So I ended up in emergency medicine, which is where I think medicine is at its best, dealing with acute problems and putting people together when they're broken. And in 2003, when SARS came to Toronto and I was involved in that crisis, I had a light bulb moment about the fact that medicine is excellent at targeting the virus or at supporting the organs that are failing, but we really don't know much about how to support the body's ability to heal itself, and why some people get more sick than others and bounce back less well than others. So that led me to 2 years of backpacking and spending time with traditional healers in different parts of the world. And that gave me an insight and a perspective that really enriched my medical practice. And I came back to Ottawa, where I'm from, and established my clinic, the Seekers Center here, and have been treating chronic pain for about 15 years. And it was this that led me to understand this basic concept that seems to underlie a lot of illness that medicine has missed.
And what is that specific illness to you? It's the chronic pain illness, I'm going to just presume?
Well, the way to understand how the body works on a fundamental level is we have hardware, which is all of your tissues and organs. And then we have software. And the software restores balance and solves problems within the body. And that software is one system that works together. It's been described in terms of psychoneuroimmunology. I call it the PINE system. So P is for the psychological part, your thoughts and emotions, your mental experience. I is the immune system, N is the nervous system, and E is the endocrine system. So your nervous system directs the immune system and the hormones to address problems regardless of where they are and what they are. And so imbalances in the pine system, or problems that are a constant trigger of stress, they can skew your body in one direction or another, and that's how we get sick, regardless of whether it's an autoimmune condition or a disease of chronic inflammation or a disease of atopy or hypersensitivity. And the things that we call diseases now are just different manifestations of that imbalance. So if you think of it from the perspective of what makes us whole and what makes us broken, one of the things that's missing that can trigger this is blockages.
What an interesting word, blockages. It makes it feel like the body's trying to work together, but there's something stopping it from doing it, like breaking a circuit for a house. If you have a wire connecting from your circuit breaker and it's not connected properly, it's the blockages, and then it's not going to power the rest of the house to go and work. Is that far off?
Absolutely. It's one of the ways that blockages block the system is by interrupting the transmission in the nervous system. When you find these areas where there is a blockage, they actually feel different. In some cases, they feel more numb. In some cases, they feel more tingly. But when a blockage releases, there's a feeling of reconnecting your awareness to a point when you're moving it. So yeah, the transmission is blocked.
Is it? So I'm just trying to wrap my head around this, right? And I'm sitting here thinking, well, okay, so if it's from a massage standpoint, or I guess more of my background, it's all right, that's a knot. Is that something that we're considering the same idea? Like, oh, I have a knot in my trapezius muscle. Is that a blockage preventing my trapezius muscle from operating properly?
Correct. It's also a knot in your tissue. So let me take this back to the point where you actually sustained an injury. Yeah. So if you fall and land on your wrist and you fracture your wrist, the connective tissue in that part of your body tears apart. And the process of wound healing, of course, if you fracture your wrist, the bone has to heal, but the connective tissue that weaves through that bone has to get woven back into the fabric that it had before. And we've accepted in medicine that tissue repair is never perfect. So the tensile strength of any wound is at best 80% of what it was in the natural uninjured tissue. And so you can imagine these fibers of collagen that travel not just through the fracture site, but travel all the way up the arm that fell and land right into here and can travel up into your head, because force doesn't just disappear at the wrist. The force travels in your fall. And recognizing that you may have a knot in your trap because of a wrist fracture you sustained in high school opens a door to targeting that lesion, not just here where you feel it, but here where it came from.
I love this.
That wound is linked to sympathetic nerves.
Yeah.
So the sympathetic nervous system controls blood supply. It controls lymphatic drainage. It controls muscle tone, and it also controls pain. So when you have an injury, your sympathetic nervous system goes into overdrive, and under ideal circumstances, when the wound heals, the nerves in this area go back to normal. But they never go back to 100% normal. They're always a little bit hypersensitive. And in some people that creates no symptoms at all, but in others, it may leave the arm as a whole a little bit stiffer than it was. It may make coordination or flexibility a little bit less, but it can also create tension in the neck. And because it affects the nervous system, it could create clenching of the teeth, it could disturb sleep, etc.
This is such an interesting concept because it's something that at least part of it I talk about almost every single day. So we have clients that come to us from physical therapy, right? So let's say they had an injury, kind of like what you described. They fractured their wrist, their right wrist. So they're going to physical therapy for that injury. And the therapist, not based upon the therapist, believe me, I love physical therapists, but the insurance companies will tell them you could only work that part of the body in therapy or we're not paying for it. So a lot of the times we'll get clients coming in saying, you know, the therapist is great and all, they're working on my wrist, but I'm feeling tightness in my trap. I'm feeling tightness in my chest. I'm kind of walking a little differently now. And I try explaining to people that's because the body is connected from head to toe. So you might have, I guess, what you would consider a blockage in that area that's triggering something else somewhere else. So it's important when you heal the body to heal the body as a whole. And that's something we practice on. All right, your therapist is going to work on your wrist, which is awesome and you need to. But now let's work on your legs and make sure they're moving properly. Let's work on your neck and make sure you're getting proper range of motion out of it, because you might have what you said, some stiffness based upon that area healing itself. So it's basically a concept that we practice already, but I guess there was just never a name for it. And no one ever put the theory and conceptualized it.
Absolutely. I think what you're describing is something that most manual therapists and most providers of any discipline eventually figure out for themselves, is that you may not be able to solve the problem in the wrist by targeting the wrist with acupuncture, laser therapy, physiotherapy, osteopathic therapy, surgery, if the restriction includes the elbow or the shoulder. And that observation empirically, when you're talking to real people trying to solve their problems and feeling things in tissue, it's obvious to us. But it's quite shocking to realize that medicine has no concept for this.
It's true. I wish I had a better response, but you're absolutely right. It's just treat the ailment instead of treat the body. And it's something I full-heartedly believe in, where you have to learn to treat the body because every single little thing is connected. Something I've mentioned, and I want to hear your opinion on this, is let's say you're upset and you're kind of really down, depressed, right? That's up in here. That's your brain. That's a psychological symptom. There's nothing going on with your body. So if that's the case, then why do your blood cells vibrate at a lower frequency when you're depressed? Why do all of a sudden you feel heartbreak? Why do you feel pain more often? Why are you more tired? Now, those are symptoms happening on the outside that are triggered from a depression, which is just psychological. It's like it's all connected.
Well, when you use the word psychological, it creates a separation between body and mind, which isn't even real. So if you think of where psychiatry is at right now in terms of defining diseases, based on the symptoms they cause. That's where medicine was at 150 years ago, when we didn't really understand how the heart worked. And we called edema, and all we knew was that it was swelling of the legs. We're just starting to understand that depression can be a symptom that is related to thyroid dysfunction, or a head injury, or a nutritional imbalance, or an emotional trauma, or vascular dementia and clotting of tiny arteries in the brain. We call all of that depression. But that's all downstream damage. If you're forming clots more than you should, maybe that's because of a genetic factor, but maybe that's because of a dysfunctional scar in your abdomen that's triggering inflammation, not just in that area, but in your body as a whole. And that same paradigm with your wrist being potentially linked to your shoulder could also be related to an old ankle injury that creates imbalance in your pelvis, which tilts your C7, T1, which affects this entire fascial chain from one arm to the next, which you contract when you move your arms together.
That I'm smiling because someone else is talking about something I talk about all the time.
Right?
It's amazing because I have clients, like, another example is they come in, they're complaining about some pain in their shoulder, like you said, but it's okay. Well, have you had any injuries? Well, not in that area. No. We find out they broke their ankle 10 years ago. Okay, that's why. They look at me like, it's like, well, think about it. You're favored one ankle over the other. You took the weight off of it because it was painful. You had a cast on it. So your pelvis was tilted. Now your body's trying to tilt back in line. So now you're cringing your neck like this. And you're doing that for X amount of time that you were injured and never really fully recovered from it because you only worked that one specific area and ignored the rest of your body.
Absolutely. And you're nodding your head and smiling because it makes sense intuitively, and it's consistent with what you've seen. But I can tell you that I didn't come from this paradigm in medicine. So my mind was actually opened and I was converted one injection at a time. Because when you see someone who, a 29-year-old kite surfer, really at the top of his game, and he's dealing with a shoulder injury that he's been struggling with for 2 years, and it's only through detailed history taking that I find out that just before the shoulder injury, he had a root canal procedure on the tooth. And I actually inject a bit of freezing into that tooth, and his shoulder pain instantly disappears and never comes back. I have to, that doesn't mean I throw away everything I've learned, but I have to give credence to that kind of evidence. That means something. And so developing this understanding of how fascia travels in here, and that, your shoulder doesn't stop at the collarbone. Some of your shoulder travels up into here, and some of your shoulder travels down into here. And so your rib cage is related to your shoulder, and your teeth are related to your shoulder. It's like, where does it stop and where does it end?
It doesn't. I just think the whole body's connected. But you were mentioning pre-show that you have this 12-step program. Am I correct? 12 steps or treatment plan that you have for people that do experience these blockages. Do you mind taking us through that and how maybe somebody at home listening from somewhere in the world can maybe better themselves and maybe help their doctor better their treatment plans?
Well, I think the most straightforward thing that a person can do without having 12 one-on-one sessions with a trainer or a physical therapist who can actually feel their arms and their legs and their torso while they're working those muscles, to actually pinpoint the spots and show them how to release them. Really just knowing that everything that's ever happened to you matters, and making a list of everything that's ever happened to you and showing it to your provider and saying, can you check me out in all these places, is a great first step. In terms of what people learn to do after a dozen sessions, it's really about one-handed exercises so that your other hand is free if you're doing a bicep curl. The other hand is exploring to feel the spots that draw your attention because they hurt, or they're tight, or they're kind of stuck, or they feel weird. And so I'm going to try to keep this on the screen. If you imagine that you have an acupuncture channel that starts here and travels all the way in here.
So roll the way down your arm.
This is what they call the pericardium channel. If you think of this as a long strip of fascia, and you understand that a bicep curl will engage that entire fascial chain, you can slide your hand from start to finish and be like, oh, wow, that feels weird. And if you find that point, you can just make sure you're exactly on it. Meanwhile, you're doing a bicep curl. All right, so deep breath in, create tension, breathe out, release tension, and focus your attention on that knot and feel release. So learning how to do that, to use movement and breath, touch and awareness, is this seeker's method.
Very interesting. So I'm going to mock it just because I need to try. So if I'm squeezing in on a tension point, do you tighten the muscle at the top harder than like you're in a really concentrated curl?
Assume that you've got a light dumbbell curl, like a dumbbell in your hand, 5-10 pounds. You just have to create enough tension to be able to feel it. And you want to trace that tension. So if you want to maybe grab your desk with the underside of your hand, and just feel from your fingers all the way up into your neck, and just decide for yourself which is the tightest spot.
All right, so you find a tight spot or a knot.
Right? So if it's in your trap, you may be better off doing a shrug. Okay? So depending on where you're stuck, you may adapt the exercise to target that area. So in your case, take a deep breath in and just focus your attention on the spot. You don't have to press with your hand. You don't have to rub it. You don't have to massage anything. Just notice how as you breathe up and you bring it in, you're increasing tension. And you want to adjust, maybe tilt your neck, tilt your shoulders to maximize that tension. And then exhale and just feel it let go.
Interesting. Yeah, it feels like just a release as you're going through that range of motion, and that a muscle fiber is getting warmed up, I guess. I think that's the wrong word, but you do feel a minor release and tension release in the area, which is really cool. And it kind of explains this practice I do for myself, because I don't have a backing behind it. So I just don't obviously do it to my clients, but with myself, if I have a super tight area, what I'll do is kind of something very similar, where I'll take something really light or even no weight, and I'll kind of slowly go through that range of motion, through that tightness, and get a little more range of motion out of that exercise for every rep that I'm doing it before I finally go into my exercise program, where it feels like it's very similar, which is awesome. Like we're both doing similar things on two different countries. We've never met before, and we're both just like, hey, we've done something like this.
Honestly, I think what I'm doing is actually just giving a language to something that a lot of people are already doing. And I think it's really important that this approach isn't just the domain of like the top few percent of every discipline. Like, 90% of physiotherapists won't be at a level to embrace this and use it effectively. But 10% of physios, 10% of trainers, 10% of chiros, 10% of everyone who's really seeking has already figured out that these things are important. But unfortunately, if you go see a doctor with a problem, they have no language to describe that. We were never taught this. So I think this is like a big thing for medicine to incorporate.
How do we get this message out? Like, we have someone there listening, they're like, wow, this sounds great. I want to incorporate this into my practice with my doctor. How would they go about doing something like that? What's the message we need to push out to, like you said, these other 90% of people in these practices that see these things? Mm-hmm. So where do we go from here is basically my question.
Well, I think where I go from here is I'm going to spend the rest of my life trying to figure out how to make this a part of healthcare. But where any trainer or any individual who wants to see if this can help them would go from here is to structure your healing journey or your wellness journey into one trial at a time. And trying a vitamin for a month to see if it's going to help you is a much more evidence-based approach to your wellness than going to the health food store and loading up on 7 supplements and taking them all at the same time and hoping that one of them will work, but not being sure which one is and which one isn't. So when you're working with natural health products, you're trying a product. When you're working with a team of providers, you're trying one provider at a time. Whether it's a physio or a trainer, you want to give them 6 sessions or 12 sessions, whatever you decide together. And if your goal is to, be enthusiastic and dedicated to your workouts because you have no real issues, that's one thing. But if your goal is to eliminate pain or reduce pain, then you should see a material difference at the end of that trial. And if you don't, then you're missing something, and maybe you need to do something different with the same person, or maybe you need to do something with a different person. But trying to tailor your therapy to blockages that you have with whoever you have access to in your community is probably something that you can do together. We have a website called seekersmethod.com where we've posted some content, but in fact, we developed 2 or 3 hours of content to try to show people how to treat their blockages on their own. And in our pilot study, patients were not able to learn it without the one-on-one time. So as much as I'd love to say in the internet era, here's my solution, I can make it available to millions of people. Right now, it's really important to learn to actually feel confident that you're feeling the right thing and that you're doing it correctly. So we're taking a slow, organic approach, but for now, find your provider, make a list of everything that's happened to you, and start a conversation.
Yeah, and be open, like I explained to my clients, to alternate theories and know where you're getting yourself into. So a short kind of to start wrapping this thing up, and I just want you to add a couple more points to this. But if I'm going to my primary care, my PCP doctor, and they're not asking me my health history to a sense, do I eat healthy? Do I get enough sleep? Do I drink enough water? What kind of veggies am I having? Am I eating veggies? Am I having 10 cups of soda a day? Am I like, if they're not asking these questions about whether I'm working out or anything like that, and I have some chronic illness or blockages like you're explaining here, have that conversation with them. Well, do you think it's considered through this? Why don't we get a more practical approach and take everything from every practice and all work together to help individuals?
Yeah, I think you raise a really important point. And certainly what I do is not typical of what the average doctor can do or is trained to do. A lot of the stuff that I do to get people well is these are techniques that I've learned outside of medical school and outside of my regular training. Unfortunately, there are some physicians who have a resistance to anything other than what's in their guidelines. But I think most doctors agree that if you have a problem that they can't address with their guidelines, then their role is to work with you to help you explore other opportunities and other avenues safely and responsibly. So what your PCP's role in your wellness journey might be is a check-in every 2 to 3 months after each trial to give you some feedback about whether it seems that you've improved or not over the course of your most recent efforts. And beyond that, of course, when you have a new problem, you need to make sure it's not something dangerous. They have a role to play in that. You may need the PCP to be involved to help you deal with insurance companies or to make provisions with modified duties at work. But I think it's unrealistic to think that if you have chronic pain or if you have connective tissue injuries, that your doctor is going to be able to provide a lot of help, because I think we all acknowledge in medicine that this is something that we don't know enough about. We don't do this well.
Yeah, it's a great topic, and I couldn't agree more with everything you've said throughout this entirety of the show. And I really appreciate this. But just last two questions that I ask everybody. First one, can you just wrap this all together in a nice silver bow and just leave us with that last bit of take-home message and inspiration?
You have blockages. No matter how healthy you think you are, we all have blockages. It's part of being human. Just because you have blockages left over from your previous injuries doesn't mean that you're not still whole and perfect despite these little scars that weigh us all down. But focus your healing efforts on your scars and it will pay dividends.
I love that. And then the last question, where can people find you, get a hold of you, learn more, and all that fun stuff?
Things are still at a very emerging stage. So my clinic is seekerscenter.com. That's in Ottawa. And seekersmethod.com is where you can find out more about the method and blockages.
And thank you guys for joining us on this week's episode of Health and Fitness Redefined. Don't forget, hit that subscribe button and join us next week as we dive deeper into this ever-changing field. And remember, fitness is a journey, not a destination. Until next time.